Have you been diagnosed with sleep apnea or some kind of airway obstruction? Do you wake up at night? Do you snore? Have you been told there's nothing you can do? Or have you been told that there's like all these medications you can take? Well, today we're going to be continuing the conversation. This is the part two of a two-part class with Dr. Claire Stagg, my favorite dentist in the world here. She is my mouth whisperer. She is the one that I absolutely trust when it comes to ch changing my bite or changing. There's certain things that I'm just like not ready for right now, but phases, like we talk about, we're going to be doing phases. So today, last month, we talked about the structural part of our body that causes these obstructions, how to breathe better, which is what we are going to be focusing on. But today we're going to be talking about the physiology and have some solutions for everybody. So so Dr. Claire Stagg, of course, is here to continue our conversation, and you can find the first one and all her videos on social media and YouTube in particular. I have a playlist for her, and you can find her and find part one if you want to watch part one first, and then part two. It's up to you. But go get that paper and pencil or pen because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here, waiting for you.
Hi, my name is Lily McDermott. I am a certified life coach, a holistic cancer coach, and the host of The Classroom. If this is the first time you're tuning in, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, as I said, Dr. Claire Stagg, the author of Smile, It's All Connected, is here in the classroom today. You can get your copy too by clicking the link below or clicking the description. If you are a subscriber to the classroom and my website, then you already have all of Dr. Stagg's links that you can go to. But this is a practical guide for any question you might have that comes about your spirit, mind, and body, because it's all connected to your mouth. It's all connected together. And this is what I've learned with Dr. Claire Stagg. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Stagg is here to do just that. Welcome back and happy holidays, Merry Christmas. This is like the last class we get to do together this year.
This is true. It's been a wonderful year, hasn't it not?
It has, and it's been a pleasure to get to know you not only as my dentist, but as a human being that is so passionate about just sharing the truth about health, and especially as natural as you could possibly. Share a little bit about, so if there's somebody that's just tuning in for the first time and they're looking at, oh, Dr. Stagg, what is your background and what made you go beyond dentistry to achieve it?
Well, what's interesting is that I got accepted to medical school, believe it or not, when I was studying in France. And I was so worried that I wouldn't be able to help patients enough naturally, that I would not know the right drug to prescribe. And I envisioned myself with this massive cheat sheet Rolodex and weighing down my lab coats in the corridors, trying to flip through in time to save a life. And I said, that doesn't seem like me. And coming from a more natural path, I decided I'll marry art and science. And so I went on and I did dentistry, thinking that I could travel more, that I could see more of the world, and I could be more out there, instead of being tied into an office. And little did I know that dentistry, there's nothing more than a ball and chain than having dental chairs. Yeah, yeah. But actually 30 something years later, it hit me like a ton of bricks that in actuality, I connect more dots as a dental physician with my patients because I see them more often. I see more of them, albeit from the neck up. But this is the master computer, if you will, of the body. It all starts in the cranium. Everything starts there. And so once you understand that the motherboard, the CPUs, the whatever are here, then everything just flows from the head. So it's really interesting to see that the teeth in actuality affect the whole way that the brain goes through the brain stem goes through the cervical spine, which affects the whole entire nervous system. We dentists can change that. We can affect the motherboard, we can affect the nerves, we can therefore affect the hormones, we can affect everything. And once we stabilize the bite and affect and change the discrepancies in the mouth, at least structurally, mechanically, and functionally, all most of the disorders that were unexplainable before will dissipate. And when the Down symptoms come back, those symptoms reappear in reversal order of when they disappeared. That was Al Fonda's dental distress syndrome paper book, The Dental Physician.
Why don't
I
more
think that's
dentists, why
fascinating.
don't, I know, but why don't more dentists know about these things, Dr. Stagg?
So,
They might know it, but they dismiss it for
no,
the,
they don't know this.
they
No,
don't know it.
no.
Okay.
Let me give you a little teeny mini example.
Okay.
Actually, two. The professor, a physician who wrote the foreword, the preface, no, the foreword to my book, Dr. Srivastava, is a professor in California, and he has been trying to get sleep into the medical schools, and they have told him they just don't have the time. They just cannot spare the time to add anything more to the curriculum because they just don't have the time, which is what we're going to talk about because your dentists and your physicians do not really know the what I wanted to talk about, the pathophysiology, the physiology, the anatomy, because we're going to still talk a little bit about that, but with solutions today.
Hmm.
Another big one that they don't have the time for is so critical is nutrition.
Hmm.
A basic physician doctor does not know the basics in nutrition at all.
Hmm.
So this is why the book Smile is so amazing because we start off with how it used to be. Thank you. How it used to be with Dr. Fonder, who talks about the structural, mechanical, and functional aspect. We talk about Weston Price, who talks about the structural aspect and nutrition, what both affect the airway, arch development, and being able to function properly. Then we talk about Dr. Roya Lee, who, and all three were dentists. And Dr. Lee talks about nutrition. And he was an engineer who created supplementation, but he knew that health started in the mouth. And so he went back to school. He went to dental school later in life so that he could also then go ahead and incorporate all that. So these three doctors knew, Weston Price and Al Fonda knew each other. And Weston Price was actually the one of the presidents of the American Dental Association back in the early 1900s. So, I mean, they knew each other. So it was a totally different mindset back then, before the revolution of the petrochemical revolution, evolution, which kind of like poof, threw the baby out with the bathwater.
Yes. Yes.
That's when they shut down. That's when they shut down all the schools, the naturopaths, the homeopaths, everything,
Well, they
everything.
actually
Because
had a campaign against chiropractors too.
yes, anything that was natural, they were
Yeah.
quacks, and it's
Yeah.
like, hello, this existed like for eons and centuries, and I mean 5, 6 thousand years. The Chinese medicine. I mean, it's coming back. I'm excited. It's coming back. Smile is the bridge between what was, what is, and what will be. So I'm
Oh
excited.
wow.
I'm I'm happy to be
That's good. That's good.
I'm happy to be part of it.
And I'm happy that that I can ride along in your coattails here to kind of expose these truths that have been suppressed for so many years. And I'm looking forward to, next year as we look at a new era that hopefully with with
Kennedy.
Robert Kennedy, that he will expose some of these truths as well. But here we
So,
go. So let's talk about
so wait,
the
you know what's something that's so interesting? It's so interesting. We talked about the fluoride issue that Florida has started as a forefront showing that fluoride is toxic. I made it a point in my book to not put any opinions in there because there's everybody has an opinion, all right?
yeah,
Everybody does. However, facts are facts, science is science. So you could
yeah.
argue with me, but you can't argue with the science. And the thing is that I made it a point to not be political and not to make it personal in Smile. It was it's a very systematic, well researched. It's heavy in research to show there are always every side to story, but let me tell you why. And let me
Mhm.
show you why, what has come up, what used to be, what is, and what could be better. So what happened is when I mean, this has been going on for decades, the fluoride issue, decades. So now our governor in Florida, who's kudos for him, Mr. DeSantis, went ahead and said, okay, we're going to be at the forefront because there was a ruling, and I know we're off topic, I'm sorry,
It's
but
okay.
there was a ruling in California that showed finally that the EPA, dudes, this isn't good for you. And so now it's like, okay, it's out there, it's like once the genie's out the bottle, you can't put it back. All right.
No,
So finally it's like it's been acknowledged. And the thing is that what really gets me is that the people should have the choice to decide what drugs are put into their drinking water and in their food. Because if they really knew, they would say no to them. Really, in all honesty, by choice, right?
yeah. And
Okay.
unfortunately, people become very comfortable with their health until they lose it. And
Well, they don't know.
I
They
know
don't know.
they
They
don't know
don't
what they
know
don't
that
know.
they're
Yep.
right. They're in ill health because they don't know that they could be in health. Well, what happened is we were talking with Dr. Ladapo and Dr. Malin. We were talking a little bit before we had our talk, the press conference. So to circle back to the conference, the researcher who was there, Dr. Malin, brought up to Dr. Ladapo, our Surgeon General, that there were children who had sleep apnea, that fluoride could cause this as well as neurological disorders. And so now we circle back to sleep apnea and the physiology of sleep apnea. And he mentioned, well, I thought it was only obese children that had sleep apnea. I said, no, not at all. So again, tying back with what I said at the conference, and Lily, did you put that press conference on your website?
I'm not sure.
That might be something that your viewers might like because it ties in as a mother. At least I know the Surgeon General talked about it in general.
Resend it to me because if you sent it to me during a time where it may have not gone through, just go ahead and send it and we'll put it in. We'll put it in.
Okay, so I'll tell you what, you can go to fan.org, Fluoride Alert Network, FAN.org, and the
Hmm.
whole entire thing is there. And you can see
Okay.
all the research they've been doing forever. And the thing is there. So circling back, we talked about the children with sleep apnea. Well, some people miss judge people thinking that only fat people or obese people or overweight people, fat, I didn't mean to say that in a derogative way, but you're
Yeah.
overweight, so therefore that's why you snore. I had a 90-pound old woman with sleep apnea, 90 pounds. All right. She had severe sleep apnea. So weight absolutely has nothing to do with it. And that's where again you have all these different causes that we talked about last time. Well, maybe we'll refresh everybody's memory. You've got the six components. Remember, we talked about them in the book: the structural, chemical, mechanical, functional, emotional, and spiritual. If you have a child that is not eating well and does not develop well and has no room for their tongue, they'll have narrow palates, all right, large tonsils, very restricted nasal passages, all right, and therefore they'll end up with very restricted airways. Now, that could be a child, it doesn't have to be an obese child. And it could be an adult, doesn't have to be an obese adult. But if you have a tube that's supposed to be this big and you get air coming through, that's a big tube. But if you have a little tube that's a coffee stirrer, there's going to be a lot of resistance. So that's what happens when you snore. That's what happens when there's a lot of weight or the fat. That's where I could say fat, per se, adipose tissue around the tubes. There's a lot of restriction, constriction that's causing this. All right. So let's talk a little bit. If may I continue then with the
Absolutely. You've got the floor. You got the floor. No,
all
I
right.
just I think it's really important that that we talk about the petals of the flower. You say it so quickly. You say structural, emotional, and so just say them once again slowly.
All right. So when I wrote the book, and this is what's interesting, and this is the hardest part when anybody asks me to talk, it seems like I'm off on a tangent all these different ways because in reality, it's one body. All right. Now, you could go ahead and divide the body into different parts. And we could talk about the neck. We could talk about the airway. We could talk about the chemistry. We could talk about the function. We could talk about how it works mechanically. We could talk about the emotion, stress. We could talk about the spiritual aspect. We could talk about all these different things. But when you ask me to go ahead and talk about the airway, each one has all those connections and you can't separate them. So in the book, what I did is I divided the book into past, present, and future. I did the structural part first. The structure is when I explain how it's put together. All right. The bones, the nerves, the muscles, the head, the TM joints, the airway, the tongue, especially the tongue. So we took special body parts that are from hair to hair, all right? And I talked about them in the structural aspect. And then afterwards, we talked about them in the chemical aspect. So for example, in airway, all right? So if you go ahead and you have a very restricted, let's go ahead and let's break it down to body parts. We're going to talk about the nose. All right. So that's one part where the airway can get restricted. That's where you'll end up having nasal passages that are blocked. You'll end up with what we call upper airway resistance syndrome, for example. All right. You're supposed to breathe through your nose. You don't eat through your nose. Therefore, you should not be breathing through your mouth, right? Okay. Well, what happens is a lot of patients who do breathe through their mouths and or who cannot breathe through their nose, nasal passages, one on each side, usually will end up with a lot of swelling in the back of their throats, back here. So people have adenoidal tissues that are swollen. We call it hyperplasia. So they could have adenoids that are swollen or tonsils that are swollen. Those are lymphoid tissues. Those are the little things that swell up to actually act as nets. So they collect all the bacteria and all the viruses and all the pollen and everything. Same thing with your nose. So a lot of times people think, well, we should take them out. Well, when you have a kid that's not breathing at all, sometimes that might be the only resort. However, ideally, go back to prevention. What can we do to make sure that the child breathes properly through their nose so you don't have to have surgery? All right. So in reality, what happens, there's two different positions. When you're up, you breathe totally differently than when you're laying back. Because unfortunately, when you lay back, your jaw collapses back. Now the tongue is attached to the jaw. So if the tongue goes back, then we have now what we call obstructive sleep apnea, OSA, and that's where the restrictions of the passage, instead of being a nice big tube, you have the coffee stirrer and it could be normally a tube that's 11 to 12 millimeters. So that's a nice big tube. Actually, I have a little 3D printed. This is a 3D printed airway that's totally collapsed. All right. See, it looks nice and wide. People say, ah, that's a big airway. But when you look at it from the side, there's nothing, right? See how skinny it is? Whereas this same patient had, actually at the time, it was the DNA appliance therapy. The same patient, look at the difference.
Amazing.
Massive change,
What did
right?
you do to achieve that? What did you do?
This was not from me. This was given to me by one because I was teaching for Dr. Singh, the DNA appliance. I was an instructor and a diagnostician for his company. And I did do the DNA appliance therapy. They've since been bought out by a company called Vivos. All right. But the appliance, what it does is it goes ahead and it expands the arches. And the arches can be expanded. It is not age limitation. Slow is best. It can be done. All right. So again, to get back to the physiology, that's where you tie in the structure, the mechanics, the function, and then the chemistry. Because if you go ahead and you change the box, now you're starting to breathe through your nose and you're going to get nitric oxide. What does nitric oxide do? Nitric oxide is created in the sinuses. All right. It creates it makes the vessels supple. This nitric gas, it makes your cardiovascular system more supple, therefore less hardening, less cardiovascular disorders. Remember, the comorbidities of sleep apnea or obstructive sleep apnea are cardiovascular disorders, hypertension, hypothyroidism, diabetes, propensity for strokes, ADHD, GERD, PCOS, and cancers. We can go on and on. So that's the chemical aspect. All right. If you go ahead and you have this as opposed to this person has a much longer chance of having a healthier life than this person who can very easily get a stroke in their sleep, for example, because they just can't breathe. Now, a lot of times, these people who can't breathe at night, also during the day, will compensate with what we would call forward head posture. So now we have all that cervical issue going on, that pain in the neck that will cause pain. Now, remember, the head is attached to the spine, is attached all the way down to the hips, is attached to the knees, is attached to their feet. All right. You also have the same fascia that goes from your tongue all the way down to your toes. You can't disconnect any part. You can't. And that's what makes this so fascinating. What is really sad in our field of medicine in this country or in the world, they've made medicine cookie cutter into boxes. And everybody, and this is your question, circling back to the original question you asked about why don't they teach this? You have the family physician who has an overall view, like the family doctor 50 years ago used to touch you. You have to be careful now because you can't touch everybody. Might be a problem. They used to take your temperature, used to have you stick your tongue out. Chinese medicine, you can diagnose 250 diseases just looking at your tongue. All right. And let's talk about tongue. You see, I digress, but I don't. All right. This is a very good thing. This is a really good little chart. If you look at your tongue, all right, and you can see the back of your throat, this is what we call the Malapati score. 1, 2, 3, 4. If you can see the back of your throat, you're a good candidate for intubation, for example. But if you go back and you do not see the back of your throat, that means that your airway is restricted. Back to this again. All right. All right. If you go ahead and look at your tongue and you see the scalping of your tongue, that's a sign that the shoebox is too small. Remember, the shoebox is the top, the shoe is the bottom arch, the tongue is the foot. There's no room for the foot. Remember the arches. The arches, if you have a pointy, narrow arch, the upper arch is pointy, the lower arch is going to be even pointier to fit in the upper to be able to chew. And then that tongue is definitely not going to fit. And then, of course, like Dr. Fonda said, if you have misalignment of your teeth, then that's a lot more pressure points when you have this joint, this mandible, if you will, that has two endpoints that's affected by all these other endpoints that are the teeth. All right. They didn't teach us all that in school. This is something that I have put together, that I've connected, that I've created all these things in a very simplistic way to understand. You know, when I was writing, it took me 10 years to put this together. And I prayed about it so much because Everybody said, you got to talk about adults, you got to talk about children. Everybody has their wheelhouse, what makes them happy, what they're specialized in. But I had a hard time trying. I kept saying, but you can't disconnect a body part from another. You cannot disconnect a person's chemistry from the way that things work mechanically. You cannot disconnect their function with their chemistry. You can't change. And that's the beautiful part of the book, Smile. Lily, I use that book whenever I'm creating conferences and PowerPoints and everything.
Hmm.
And I have to tell you, I am so freaking amazed by what's on those sheets of paper. I am. I tell you, that writing was divinely inspired because I go
Yeah.
back and I say, oh my God, I wrote that.
Who was
And
the genius
I
that wrote that? Oh, that's me.
no, no, it's not even, I swear to God, I
No, it's
felt it.
that's how I write too. It's a
I
download.
felt it.
It's called a
I
download.
felt right. I felt Weston Price. Say this. I felt Alfonso is like, finally, somebody's putting it together. I was like, okay, okay. And it's just, it's so fascinating. So coming back again to the Robert Kennedy, it's like, you know, think about it. Smile is like a freaking blueprint for this MAGA thing, MAHA, Make America Great Again, Healthy
Mega.
Again. Sorry,
Yeah.
sorry, I mix up all the acronyms.
Yes,
But
yes.
if you think about it, it just connects everything. And it's like my wish, my dream is like somebody just hand him. I would be happy to give him a smile just to say, look, it's here. You've got us who know this stuff. We're willing to help you. We're willing to help. You've got such a grassroots movement of
Mhm.
people who are so hungry to understand how they can take ownership of their health.
Yes.
And another thing too is that I know why it took 10 years, because it took 10 years to get this book out. Think about it. The world wasn't ready back then.
No, and it's I'm very hopeful. I'm hopeful it's ready for now. So last time we got together, we did talk about the structure. And
Right.
so how is the conversation today different? What are we going to so I love that graph because I'm going to look in my mouth afterwards, but I think I am class one.
All right, so that's good. So now let's talk. If you're class one, so we're going to talk a little bit about the disease. So we'll talk about options.
But
All
you know
right.
better because you photographed my mouth more times than than a model
Can
photographs.
you see these
Yes,
pictures are
just
on my web
angle it. Yes.
this way, this way.
Yes, there. There you go.
All right. So this is, for example, a Malapati class three. This is afterwards a Malapati class one. And this solution was by a CO2 laser therapy, non-surgical. Think about it. You're back there, you're laying down, and the drape has your soft palettes totally closed. So this little part, that little pink part that's there, this drape has totally overclosed and shut off the valve. All right. So think of it like a toilet valve in the toilet bowl. The valve just shuts and the water can't go out anymore. It's the same thing. You can't breathe, you shut the valve off. Well, what happens is with a CO2 laser, think of that screen where you can't see the movie because the curtains are drawn. All right. We could use a CO2 laser to shine the CO2 light, or the laser, if you will, light on that closed curtain, and it stimulates the collagen, which will then shrink those very narrow foci or the very narrow opening, which is the inflamed soft tissue of the uvula
Yeah.
and the palate. And now, whoo, you can see the screen, and now you have air
I
passing through.
have to tell you that there was a time, and I don't know, I'm so lucky that right now Robert isn't doing a lot of snoring, but there was a time where his snoring got really, really loud, and it became a problem. I'm a very light sleeper. Most moms are. And so he went to a dentist or some form of dentist. And she said, or a doctor, a surgeon, I have no idea, but she did this surgery where they cut, like to for people that are snoring, they
The triple
cut.
UP, the triple UP.
It sounded so painful. But what
Did you
you're
do it?
talking, no, he's not going to do it. I don't care if he continues to snore. That sounded barbaric.
It
And
is. So
here's a simple, do you do this in your office?
yeah, we have the laser. We could do it. Yeah.
I'm going to
So
send him
the
over
trip
there.
so the triple UP is uvuloparangeoplasty. Oh, I must have left a triple uvulo. There's three U's, a P. Plasty is the end where they trim
Mhm.
it. So literally they shave off that flap. Well, that's a problem because you can get food go down the wrong pipe. And sometimes if the inflammation or the root cause, and I laugh because root cause, haha, dentist, if you don't take care of the root cause, then you're still going to end up having problems. So you're still going to have inflammation.
Oh, that sounded so painful. I said, absolutely not. I mean, he was willing to do it just so that I could have a good night's sleep. But I'm like, no, no way am I going to say that that is more important than than not snoring. But it sounded so barbaric. And here you are talking about the CO2 laser.
Right. Yeah. So let's continue
Is
because
that an expensive procedure?
no, it's not. I mean, your HSA or your FSA can cover it because it's a medical procedure. So it is coverable by your medical insurance usually.
Wow. Go ahead, keep going.
Okay, so I want to still talk about because we're people who have options. Now, remember, I am going to present the root cause solutions, whereas the average person out there is going to give you the symptom fixing, as in the symptom band-aids, right?
Yeah.
So, standard of care says mild to moderate sleep apnea. You go ahead and you use an oral appliance by moving the jaw forward. There's two things you need to do to help the airway. One is vertical and one is protraction, moving the jaw forward. All right. Well, unfortunately, there's just so much you can move a jaw forward. Okay. Eventually, you end up with a joint disorder, and then your bites off. So, and then the inflammation has not been addressed. So now you end up still having a problem, right? This is mild to moderate sleep apnea. Severe sleep apnea, they say you should get standard of care, says you should get a CPAP, continuous positive air pressure. All right. So there's that. Now, let's go ahead and let's talk a little bit about appliances. So this is, for example, different appliances that have different way with or without elastics, how they work. You bring the jaw forward, etc. These are different sleep appliances. I don't do too many of these because people really actually want to get better. So they are not ready for band-aids. This is, for example, this is another little diagram to go ahead and to show you when you lay down how that uvula goes back. And that's what they wanted to trim off your husband. Actually, this is the tongue, sorry. So this is where the uvula, this little guy that fell
Yeah.
back, this is what they wanted.
I thought that, yeah, there we go. Okay.
Yeah,
So
this is
you
the
got the
tongue.
tongue.
So
Okay.
when you lay down, this whole thing goes back, and that's when you get the obstruction, right?
Where's the uvula? What happened to the uvula?
This little
Okay, there you
guy,
go. So
this
bring it
little guy.
down now. Let's see what happens. Let's see with your little, there you go.
So
So
now you
now
have
it's
a
close it up. Yeah. So I just
total
wanted you to,
one,
yes.
right?
Hmm.
But this is what happens if the jaw's back, then everything's closed up. So what they do is they go ahead and they bring the jaw forward, and that opens up the airway, right? As opposed to the jaw back. So they put the appliance in, and then the jaw comes in. The only problem is though, is that unfortunately there's just so much that you can bring the jaw forward. All right, because then you end up with a joint disorder. And then interestingly enough, I like this little guy. I'm still trying to figure out how to use it because there's so many little parts that move. And I think it's a good diagnostic. So this part is the airway, but when you have a lot of inflammation, now look at all this together. Isn't that sad? Where do
Hmm.
you breathe? How do you breathe? There's nothing
Yeah.
to breathe with.
Yeah.
It's all gone.
Yeah.
All
I
right.
see it. I see it.
So
What a
yeah.
great
So
little
this
gadget.
right. I won this at a conference. Another little tool. So we have another little tool. I like this one because it's my little, it's a little go-to guy for people who come in on a crisis mode and they're in pain. And I could give them that. But my goal, what I
Oh,
have a passion.
wait. What you showed it very quickly. What is that little go-to guy? Talk a little bit about it. What is it?
So there's this company called MyoBrace, and they have TMJ, a little TMJ appliance that's this is a smaller version that you could actually clench, hold. and it helps not have the teeth together. Actually, I had it upside down. So it's like this. It holds the jaw. It's really, it helps more with the jaw joint. Um, it's a Band-Aid. It's just a temporary appliance. It's not something that you should wear forever because you're not really addressing the root cause. And my concern, whenever you have anything, and this is what gets me, all right? And I'm okay, and I'm just gonna put foot in mouth, but I'm gonna tell you about a case that really gets me. Really gets me. You ready? All right. I had this
Yes.
woman, I had this patient, unfortunately had typical orthodontic treatment as a kid, 4 premolars extracted to make room, 4 wisdom teeth extracted because there was no room. All right. So now there's a space here where the 4 teeth are. So we've extracted them. We call them 4 on the floor in our terminology, in our field. 4 teeth extracted, premolars, 4 more. So now instead of 32 teeth, we have 24 teeth, right? Okay. Think of a garage that you have a semi in, all right? And you have, let's say, 30 by 30 by 30 by 30 square feet. The semi fits nicely in there, which is the tongue, all right? You decide that the walls weren't too straight. You're going to make them straight. And in order to do that quickly, efficiently, fast, all right? Quickly, efficiently, fast. You're going to make more room. You're going to take 2 square feet off each side of the walls for the garage. How much square footage do you have left? Do you think your semi is going to fit in the smaller garage?
Absolutely not.
And this is something I want people to be cognizant of. They can go ahead and make that decision to not have extractions. You can have your arches expanded at any age. I had a conference call with a patient from New Brunswick, actually somewhere in Northeast Canada this morning. All right. None of the doctors in her area want to expand. They say it's not possible. Standard says that after 9, the face is fully formed. You know, my poster child, I've expanded her. She's 83, probably 84 now
Yes,
with the
yes,
AF, right?
yes.
There are so many different options, but they don't have time to teach this at school because it's just not. But there are us who do. So we're more in it to help, I guess. I don't know. I mean, I try to figure out, I try to figure it out, and I don't know. It's just I care more about the outcome and the people
Yeah,
than about the money because
yeah.
I spend more time because it takes a lot of time in hair and in hair. It takes a lot of care. It takes a heck of a lot more time to try to sleuth out why these things happen, what rabbit hole they went down to figure out which way to bring them out the most economically. Because a lot of times people don't have money or the extra time. Those who do, it makes my life a lot easier. But then I have to be very creative for those who don't. And I
Hmm.
give them the option. You could do it this way or you could do it that way.
Yeah.
I won't do it the other way. I won't take teeth out and I won't do it this way. This is what
I mean, you will
I have.
take teeth out if they need to come out, but you're not removing them to make room.
No, well, that's an oxymoron to me. So if I could, once you've been red pilled, you can't go back. You know,
You can't
yeah, you
unhear the truth. You can't unhear
there
it.
you go.
Yeah.
And that I think that's what Smile is all about. It's like here are all the red pills in one big jar. Which one would you like first? That's it. It's like they're all there for you.
Yeah.
You can have them whenever you want. You could pick it the front and the back and the middle and the sides, whatever. And it's from the perspective of a mom who happens to be a dental professional who had her kids who went through all the issues that they all have that are going on around the world all the time. It's
My
simple.
goodness. You
All the
know,
red pills are there.
and all the orthodontists, all they want to do is they want to remove the teeth. They want to remove the wisdom teeth. They want to remove the extra molars so that they can make room. I never even thought of that.
You have to give them credit because this is how they're taught.
Yeah, of course.
All
Of
right.
course. It's not
And
intentional.
right. And there are a lot, it's like a behemoth of a mammoth of a momentum. That it's hard to stop the train with a momentum. I think of a freight, big freight boat, the ones that have all the cargo ships, on
Hmm.
them. This thing takes a while. And then it's like, oh, wait a minute. Does this make sense anymore?
Yeah.
No.
Yeah,
Stop. Let's turn the ship around. Takes time.
it
So
does.
what I'm hoping, I'm not belaboring, I'm not talking negatively about the orthodontist per se. I'm not belaboring anybody because everybody's a good person. What I'm critiquing are the techniques that have not evolved for the good of the patient overall. That is what I am belaboring. That is what I'd like to see change. I'd like to see it just like in dentistry. There's so many other things like mercury, fluoride, whatever. It's all there. Those are the big behemoths that we have to change. It's like, okay, is this really working out for everybody?
Well, I think that right there, just, I mean, how many of us are putting braces on our children? This is some information that we need to know. That I know that Blake, my youngest, he had his palate expanded when he was about 5 years old, and they did pre-braces with the palate expanded. I
Right,
remember having to crank that little thing open
right.
for him, and it's interesting that, but I don't know if he had his teeth removed, or how many of my children, but this is a good note here. There's natural solutions for sleep apnea. There's natural solutions to expand your palate so that you can breathe more. There's so many different things, and that's what we talk about here in the classroom. And I want to take a minute to talk about my website. I want you to go to whenyouneedafriend.com. Please like and follow me on social media, subscribe to my website, and pretty soon we're going to look into Rumble. And so check it out. Keep your eye out for him. I'll make an announcement on my blog. But I want to encourage you to go to whenyouneedafriend.com. This is where we take ownership. I want you, if you want to send this to a young mother who is about to make a decision on their children and whether to extract or expand. And so this is a great information for you. This is where we take ownership for our life. And as we're entering the end of the year, going into the new year, I want to challenge all of you to learn something new. Because once you learn a new truth, you can't unlearn it. Once you see something real and factual, you can't unsee it. So I want to encourage you to take this information that Dr. Claire Stagg is sharing and pay it forward. Share it, share this video with your friends, and go check out my sponsors. Support them the way that they're supporting the classroom. Check out my Shop Now bag with all natural, chemical-free ways that you can reverse and heal your body. And so just and again, you have you have the power. We have been told we don't, and that we need to trust the white coat, hear and obey. But only you, when you hear these truths, again, you cannot unhear it. So I want to encourage you to help out the classroom. This is going to be one of the last time that Dr. Claire Stagg is on, but we've got another week of classes before we decide that we're going to take a little vacation. And but I want to encourage you that if you would like to donate to the classroom in any way, please consider it, whether it's your time, your talent, your treasure. All of it is appreciated. Sharing this video, making a comment, putting an emoji, all of it is a way to help the classroom grow. And I'm so grateful to Dr. Claire Stagg. You can find her, if you have subscribed, you have all her information. You can find her at smileprofessionals.com. I think that's Smile
That's one. That's
Professionals.
the
Yeah.
office, Indian
Yeah.
Harbor Beach. Yeah.
Yes. And it's is it smiled is it
Smileprofessionals.com is the website for the office.
yes, for some
Health
reason I have to hold on.
Connections.
Health
Health
Connections.
Connection
That's it.
Dentistry is the community website that we created for people to have the resources, for example, on sleep apnea, the resources on arch expansion on adults.
You also have that handy dandy, and one of the videos that you did, we added it to the link, which was the connection with the meridians of your mouth and different body
Yes,
parts.
it's on there too.
That's on there too. And
Mhm,
so you do so much to
mhm.
empower us to make these choices. So what else do you have? Oh, and you can you can call 321, and all the information is right here, right behind us. There it is, smileconnectionsdentistry.com. I don't know why I have this.
No,
I
no,
think I
it's Smile Professionals or Health Connections Dentistry.
healthconnectionsdentistry.com. I just messed it all up because I'm looking at Smile Professionals here and I've got the healthconnectionsdentistry.com.
Yes.
That's where you want to go, right there. So I
Yeah.
want to encourage all of you to support Dr. Claire Stagg. She's giving you this information. Get the book. You could go to Amazon, click on the book. I've got the book in the blog. Just click on the link. It'll take you straight there. Get your own copy so that you can be your own
Can I
advocate.
ask a favor?
Sure,
Can I ask a favor?
sure.
This
What's
is
that?
really important. All right. The book is phenomenal. And I have distributed because I had so many people that endorsed me and that were kind enough to go ahead and to tell me what an amazing book it was. I would so appreciate if you can write a review. That is what gets the algorithm up on Amazon and a review because they're all 5 stars because it's such a good book. The reviews help other people who are looking for the information. It will help many others make the decision to find what they're looking for. If they don't read a review, then they won't know what it is. Okay. I
Done.
have one more thing that I
Okay, what
want to
else do we have before we go? We have 5 minutes left, about five, six
I,
minutes left.
I have one thing that's going to be the bomb. You ready?
I am ready.
All right, so we're gonna tie it all in. All right. This year in January, I took a course. It was in the Caribbean. I went there in the middle of winter to promote Smile. And then I was going to take more classes, more orthopedic classes with wire appliances. And one of my professors says, Claire, why are you doing wires? There's an aligner system now called the Nuvola that actually goes ahead and has a cranial component to it. So
Which I'm thinking
aligners
about doing. I'm thinking about doing in the
so
future.
aligners you know what Invisalign is? It's a company that in California that created the aligners, which is where they put little composite stops, and every 2-ish weeks you get a new plastic tray that will torque the teeth whichever way so then the teeth can move. Well, for the longest while, it was only dental movement. It was nothing to do with orthopedics, which was a really bummer for us who wanted to have arch expansion. Well, just recently, they opened up the field where they added an arch expansion component to it. Now, fast forward to November, where finally, well, I did a sleep pediatric class in the spring where we actually worked with children with a Nuvola and other orthopedic appliances. So did it with children, which now we could also do with adults. And then fast forward to November, and I went to the first launching of the Nuvola in the United States to show the whole program. Now, this aligner system has trays, if you will, but it's so beautiful. It's created in Italy and it has little pins on the trays. So that means, so think of it as a little driving force. And there's an appliance that you wear that you chew with 30 minutes at a time that acts as a myofunctional device. It's called the Freedom. And what it does, because you have that force, it creates those piezo forces through the vomer, which is through the nose, up through the head, if you will, the bones up there. And what it does is the forces work on the cranial bones, on the base of the cranium. You know what that does? Is it goes ahead and it balances everything. So, for example, the eyes that were crooked, the cheeks that were crooked, the ears that were crooked, the smile that was crooked, everything starts lining up. And also
Amazing.
posture,
Wow.
posture. So now this is taking orthopedics and orthodontics to a whole new level.
I know
It is
we've been waiting for
amazing.
this, and I'm so excited that you got certified already, right? You are you are qualified to do this in your office today. And
Right.
so can you show us what it looks like?
Sure. So, well, actually, they're going to be on the website, but the company is called. You can go on there. It's called www.nuvola Nuvola world.com. All right, and a couple little pictures. So these are the little pictures of the kids, if you will, of the appliances that actually that's called the Freedom Junior. This is the Freedom. See how the little slits right here, all right, for the adults, and then the trays. So I'm really excited, and I ordered an intraoral scanner because now we have to keep up with technology because this company is in Italy. So then they're the only ones that do this. So now we have to send digital scans to Italy for them to create the trays to be able to do this because they're the only ones that have the freedom. It's a proprietary thing, but I'm really excited. This is what we've been waiting for. It's connecting all the dots and to see what they've done with it. It's like, oh,
So
to be alive in
you
this
showed
time.
pictures of children, but this is also for adults.
Yeah, look,
Yes,
adults.
yes. And so this will help expand your palate. And so this is the perfect solution for someone with TMJ.
So that's where you have to do the diagnostics first because you have to make sure the hinge is fixed before you start messing with the teeth. So that you still have this is where you really need to know have somebody who knows what they're doing too. Because if you go ahead and make these guys okay and you align things, you may have still have that displaced disc. So you
Mm.
got to get the disc healthy and then you could work the teeth. Yeah.
Well, I'm
Don't try and
excited.
get out of it, Lily. You gotta do it the right way.
No, no, no. I thought that this was the right way. I thought, because I already went through all the stuff. You know what's going on in my mouth. You know that I've got TMJ and that I need to expand my palate. So I just it's like baby steps. And I've been waiting for November. I was waiting for this day. So we're looking forward to going into the new year. Maybe we'll do a class on Nuvola. It sounds like a disease.
No, Nuvola, think new.
Yeah, but it's such a
Voila!
okay, there we go. Nous voila. There we go. That's how it is.
Voila!
Okay. Like
They'll
e
be they'll
I'm
be
thinking
very fun.
Ebola. I'm thinking about but okay, so
Oh
we
no,
have
not
about
Ebola. No, 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 no,
I
no.
know, it just sounds a lot like it, okay? I'm just saying it just blurted out of my mouth. What can I say? But this is the last class of the year. We've been doing classes together. I've enjoyed your time. So what is your advice and your wish for our listeners, our viewers, our followers as we go into the new year when it comes to all of it being connected? What is your goal? What would you like to see for all who are watching and listening to you today?
I think as I mentioned, it's a great time to be alive. I'm so excited to see that the momentum is changing in the right direction. I'm so excited to be part of it. I will do whatever I can to help. I would love to teach more. I would love to podcast more. I'd love to write more. It's just finding help to help me because I don't have enough time in my day and still run a practice and try and run all the businesses that I have. There's so many things that I want to do, and I'm looking forward to helping more people by doing those things. Does that make sense? So
It
it's
does,
just
it does, it
it's just a
does.
matter of putting it out there and sharing what I know because that's where I get my joy is like, ah, look, did you think of this? Did you think of that? Did you think of this? You could do this. You could take charge. You could be well. This is exciting, don't you think?
I do. And what I think I get out of your classes every time is that you're never too old to 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 be connected, for your body to improve. You're never too old. And so I just want to encourage all of you once again to get Dr. Claire Stagg's book, Smile, It's All Connected. Not only that, but write a review once you get your
Please.
book, please. And let's kick off the year. Let's end 2024 behind and let's look at how we can improve our body with all the different pillars in our life. So what one last word before we go?
Yes. So one of the words you mentioned is say we keep saying it's all connected. I think the issues where people have been disconnected and we want to reconnect to
Yes.
self, to get reconnected to their whole self, be it mechanically, structurally, emotionally, spiritually, chemically, and functionally. So it's all connected. So we're going to reconnect. We're going to put the dots together.
And I look forward to doing that with you. You know,
Yes.
when you said
Thank you, Lily.
disconnected, dis-ease,
Dysfunction.
dysfunction. So let's be in the let's not diss ourselves. Let's embrace let's embrace our health and remember to smile. Thank you, Dr.
Right.
Claire Stagg. I want to wish you a Merry Christmas and a happy holiday. I know we'll be coming together after the year to spread more news and good news about how we can reinvent ourselves and put ourselves together so that it is all connected. So thank you so much.
Thank you too.
Once again, Claire Stagg, you can find her at 321-777-2797. Just a drive to beautiful Indian Harbor Beach, Florida. It's a beautiful office. She's like Inspector Gadget there. She has everything for you, especially for those of you who are snoring. This procedure, I'm going to send Robert in there to get this procedure. And maybe we'll do a show just on it, video record him and do all this stuff so that people can see that there are things we can do to promote a healthy life. So thank you so much for
Yes.
inspiring us all. Dr. Claire Stagg, thank you.
Thank you, Lily.
And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day
Ever.
Good job. Good job. That was good timing. That was connected.
Yes.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.